This is the virtual presentation of the work titled Breaking the Boundaries: Academic Applications of Multidisciplinary Research in Computer Science and Dentistry. The improvement of education is one of the main strategies for the development of society being actively executed by most of the countries. This is considered among the 17 goals to transform our world posted by UNESCO. Education, and more specifically higher education, is crucial for developing countries, such as Ecuador in South America, where different initiatives had led to a significant increase in student enrollment and graduated professionals according to UNESCO records. Nonetheless, the emphasis of these strategies has also been controversial, because cognitive skills and professional competences are more related to economic growth rather than the amount of people graduating from universities. It is possible to sustain that quality in education is preferred over the quantity of graduate professionals. Therefore, the current trend in higher education is the promotion of technical skills over general ones. This is pursuing specialization. On the other hand, it is important to notice that learning is a multidimensional activity. Therefore, encasing higher education curricula within a hard set of skills may be detrimental on the long run. This is because some aspects of the formation are set aside, thus forcing students to learn them on their own when needed. This leaves us the question: what is better, specialization or generalization? Today there is a major trend in the business world in favor of multidisciplinarity and generalization. As such, we consider that generalist formation is exceedingly important for the advancement of science and economic growth, especially in developing countries. Furthermore, innovation generated from multidisciplinarity has proved to be the key factor of economic growth of developed nations. In this regard, one of the disciplines that has been receiving special attention of the public in recent years is dentistry. Dental research has exhibited significant improvement thanks to the involvement of technological solutions such as digital imaging, computer-assisted diagnosis, computer-assisted design and manufacturing, composite material design, cellular engineering, and tissue regeneration. Multidisciplinarity has been essential to these developments, but multidisciplinarity in dental education is often achieved on higher research contexts such as postgrad and commercial initiatives. Dentists are encouraged to buy new devices and materials constantly, but the involvement of dental schools in the development of these new technologies is very limited. Innovation in dental technologies can be resource-intensive and highly time-consuming, thus making it even more difficult to perform in developing countries. We explored the possibility to present the notions of computer-aided diagnosis of dental diseases to the students of the Dentistry faculty of the University of Guayaquil in Ecuador, and to integrate computational science students of the University of Malaga in Spain with cross-disciplinary teams, aiming to generate experiences with real-life application problems. With this, we expect to enhance diagnosis skills of dental students while introducing the concepts of applied computational intelligence, image processing, and cross-disciplinary collaboration. A total of 200 dentistry students were divided in 4 groups, consisting of 50 students each, while 64 engineering students were divided in 2 groups, consisting of 32 students each. Students from both centers participate in the extension of a cross-disciplinary research project, receiving feedback of the process obtained during each session. For this project, we leveraged a previous research project performed in the Department of Languages and Computer Science of the University of Malaga, consisting of automatic segmentation and classification of image regions using computational intelligence and image processing techniques. This software was designed to accurately identify dental tissues in different levels of disease and dental restorative materials such as metal amalgam and composite. In the case of engineering students, first an oral lecture was given, followed by a round of questions. On a second session, students were instructed to perform an interview rehearsal to one of the dentists involved in the computer-assisted diagnosis research project, the aim of confronting them with a real-world case and scenario and cross-disciplinary teams. During the interview, students were required to identify the key factors of the research project. This is objectives, biomedical research methodology, ethical guidelines, privacy of information, population involved, biomedical and dental lexicon, and the requirements of the computational systems involved. At the end of the sessions, students were asked to develop a mock-up application that would satisfy the necessities presented by the dentist expert and the proposed system. Finally, on a third session, engineering students performed a brainstorm while presenting the various mock-up applications. With this, it was possible to establish a well-designed guidelines for development of a new application that will fit the necessities presented during the challenge. In a similar fashion, dentistry students were presented first with an oral lecture, followed by a round of questions. Then, on a second session, students were directed to reproduce the training of the system's dental tissue classifier using the original provided tool. The task was to actively identify dental tissues in the corresponding segmented regions of digital images, intended for training the supervised classifier. Furthermore, students were asked to detail all the difficulties and problems they may found by using the tool. This information was then communicated to the Informatics team in order to be used during the interview sessions. Finally, on a third session, dentistry students were presented with a revised application, constructed by following the guidelines recorded during the brainstorm sessions of Informatics students. This enhanced tool was used as an aid during clinical diagnosis of real patients as part of the regular training exercises of students. The ability of dentistry students to correctly identify dental tissues was recorded on all students after each session. Students were asked to identify the corresponding tissue to 10 randomly selected regions of a set of digital images that had been previously verified by a group of experts and used for calibrating the original image processing system. The null hypothesis was that there was no differences among the mean score obtained by students on the tissue identification task, taking into account the session number as the fixed factor and evaluated with ANOVA with 95% confidence. We consider important to notice that the execution of the present study was considerably fast, taking into account that the distance between institutions and the differences between the disciplines involved were considerably high. Therefore, we consider this a sign of success. Furthermore, results show that the goals were obtained, thus demonstrating the capabilities of students to work in real-world problems and indicating a strong motivation for the project. Finally, results show that the diagnostic abilities of dental students improved significantly over a short period of time while participating in the development of the computer-aided diagnosis system. For all this, we conclude that multidisciplinary research for joint innovation in dental and computer sciences is a strong and viable approach in the formation of undergrad students of both careers. Therefore, we strongly suggest that these efforts must be encouraged during the formative period of university students. Thank you for your attention.